Hello Andy. Today I just want to discuss about gallstone disease, which is a common problem. Most of the times we see incidentally on OPD basis on a regular checkups scan showing gallstones. So what are these gallstones? These are of two types. Mainly 90% are cholesterol gallstones because of the cholesterol deposition in the gallbladder, and the second types are pigment gallstones because of the excess bile pigment, that is bilirubin. So coming to the cholesterol gallstones, what are the risk factors? So we can remember by 5Fs. So those who are above 40 age groups, and especially females have 4 times more common tendency than males because of the estrogen hormone levels. And those who are fat or obese, those who are being treated by fibrates for hypertriglyceridemia or high cholesterol problems, and other causes are familial. Genetic reasons also play a role. So coming to the pigment gallstones, it is mainly because of the high bilirubin or bile pigment. It is seen in liver diseases, especially liver damage or cirrhosis of liver or any liver infections. And other reasons are liver being normal. We see pigment gallstones in hemolytic anemias because of rapid destruction of red blood cells. The bile pigment is formed excessively and it deposits in the gallbladder. So coming to the cholesterol gallstones, the pathophysiology, the cholesterol, the reasons are mainly fatty liver related disease problems. So in fatty liver disease, the excess cholesterol, which cannot be concentrated by the gallbladder, it gets formed into the stone. So in pigment stones are because of the bile pigment. So coming to the symptoms, most of the gallstones are asymptomatic, no symptoms. 70% doesn't have any symptoms. Usually stones less than 5 millimeter doesn't cause any symptoms, but there are sometimes lesser size stones are have tendency to stuck in the bile duct, which is below the gallbladder. So above 5 to 10 millimeter gallstones have typical symptoms of bile colic. That means colicky pain or crampy pain below the ribs, right side, because of the it is stimulated by fatty food or because of the distension of the gallbladder. And this gallstones above 5 to 10 millimeter can cause gallbladder infection also, that is polycystitis. And sometimes by a gallstone can stuck in the bile duct, which is below the gallbladder, and obstruction to the bile flow and sepsis. So it's a life-threatening condition. It has to be treated with ERCP stenting, CBD stenting, and all. And suppose if gallstone stuck in the pancreatic duct, it can cause pancreatitis, pancreas inflammation. So it has to be treated accordingly. So how to prevent these gallstones? Again, the risk factor prevention, lifestyle modification. Rapid weight loss also can cause gallstones. So the weight loss in obese patients should be very gradual, like less than 5% reduction in 3 months. If for asymptomatic gallstones, no treatment is needed. For symptomatic gallstones, we can try ursodeoxycholic acid in 300 mg to 3 tablets per day, and we can see a check scan every 3 monthly, 6 monthly, and 9 monthly. So even after 9 months of scan and not showing a resolution of gallstones, there is no role of to continue ursodeoxycholic acid, and these patients have to be subjected to surgery. And patients with who develop gallbladder infection, cholecystitis or any pancreatitis, they have to undergo gallbladder surgery. There are two types of gallbladder surgery: laparoscopic and keyhole surgery or open gallbladder surgery.